Oh, thank you very much, Michael. So gut health starts in the mouth, and a lot of people don't realize that. There are many functional medicine doctors and patients that work on the gut for years and years and years and years. And what's hampering the ability for these patients to be well is the fact that there is toxicity and inflammation in the mouth, which I've been looking at for 40 years, and understanding that there is a very big connection. And that's why I wrote this book, The Mouth Body Connection. And I wrote this, ironically, for the layperson, and I get more emails and thank yous from dentists who never knew a lot of what was in here because they weren't taught that in dental school, like cavitations and what's wrong with root canals and all that stuff. So today we're going to really take an interesting look at the mouth body connection and its role in total body wellness and longevity. So I'm going to actually go bring the presentation up now. I'm expecting, is the screen, can you guys see this?
Oh, no, Dr. Curatola, can you open the Zoom window again?
Yes. Yeah,
Yep,
let's do that again. Thank you.
Mhm.
Okay, here we go. I have to make
Yep.
this big. All right.
Yep, and
And
here,
we're
do
going
you
to
see? Yeah.
share the screen. Got it. And I'm going to be sharing my desktop. Okay. And here we go. Let's see if this works. Okay.
Looks
Can
great.
everyone see that?
Yep.
Okay. Thank you. All right. Once again, here we go, everybody. I promise it'll be a treat. A lot of people don't realize that your ability to live a longer, healthier life is tied to this mouth body connection. So, total body wellness and longevity is going to be the topic today. And we're going to be looking at root causes of what compromises that and a lot of things that you probably never knew before. One of the, um, so I always loved this quote from Rene Dubos from 1965 that the state of your health or disease are the expressions of the success or failure by you to respond adaptively to environmental challenges. Now, all of us and many who are on this program, Truth About Health, are going to be talking about a lot of those environmental challenges, both outside your body and within your body. So, the ability for you to respond adaptively plays a key role in your ability to live a longer, healthier life. And as I like to say, oral health is the 800-pound gorilla in the wellness room. And even ancient Ayurveda said you cannot have a clean, healthy body without a clean, meaning healthy mouth. Not that you brushed and flossed. It means that the really, if your mouth is unhealthy, you will not have a healthy body. Um, the real problem with the mouth not being understood in the medical community and really by patients as well, thinking that dentistry was more of a mechanical thing. You know, you get a filling, you get it filled, and you get a cavity rather, you get it filled, and you go get a brush twice a day and get your teeth checked twice a year, and then you're groovy. But the reality is that 90% of toxicity and inflammation in the human body starts in your mouth. And, about 150 years ago, they unplugged dentistry from the rest of the body. And they said, oh, if you want to study this little cube in the mouth, then you go to dental school and physicians study everything else around that receptacle. Notice the feet are cut off because then you go to podiatry school. So this illogical divide has hampered our ability to treat the whole patient. The father or the forefather of the mouth body connection goes back to a really amazing person, Dr. Weston A. Price, a dentist from the early 1900s. And this dentist actually in 1917 was presenting on the status of our knowledge of the relationship of mouth infection to systemic disease. He was talking about the mouth-body connection. And what's interesting, this was to the St. Louis Dental Society, and what's interesting is that they scoffed at him. They laughed at him. They didn't think that was true or that was possible. And now we know, indeed, it's exactly that. So I wrote this book, The Mouth-Body Connection, to really help everyone understand the bidirectional effect of the mouth as a mirror of what's happening in your body and a gateway of chronic inflammation, of toxicity throughout your body that dysregulates the body's microbiome and dysregulates your immune system. And this is linked to everything from cardiovascular disease, type 2 diabetes, obesity, premature birth, Alzheimer's disease, and more than 6 types of cancer. 6 types, ranging from oral cancer to breast cancer to lung cancer, pancreatic cancer, colorectal cancer, and others. So the reality is esophageal cancer. I knew I was forgetting one. But we would say, how is this possible? How does what's going on in your mouth cause colorectal cancer? And we're going to speak about that. So the mouth is a mirror to the body. We even know in the ancient science of Ayurveda, which I'm a fan of, our tongues are a very powerful and primary diagnostic tool, because when digestion is working well, it influences every aspect of our health. And when you may not think about it, the tongue is the beginning of the digestive tract. As I said, gut health begins in the mouth. And we look at lots of different things. There are different tongue characteristics that correspond to Vata, characteristics, which Vata tongues are typically dry, narrow, smaller, rough. And then you have Pitta dosha types. So the three dosha types, you have Vata, Pitta, and Kapha. Pitta dosha type tongues are typically reddish, medium size, somewhat dry, and have a pointed tip. And then Kapha dosha types, these are the large, thick, wet, light pink in color. So you'll see these different characteristics in the tongue as a mirror to what's going on in your body. And the most famous is something known as the meridian tooth chart, that every tooth corresponds to a meridian to various organs, tissues, and glands in the body. And these meridians are also known as energy highways. And blockages in one of these meridians, say on an upper molar here, on the upper left, that's on the right side, tooth number 14, that would correspond to the left breast, thyroid, stomach, and pancreas. So you really have a lot of interesting analogies. The upper left is spleen. The upper right molars are, here you can see the breast, the thyroid, the stomach, and the pancreas. So the spleen on the left, the pancreas on the right. We see people have root canals or infections in these teeth, and we see all of a sudden they're getting cystic breast, they're having thyroid malfunction, gastric issues, and it's especially notable like with root canals that are failing, where you have infections, heavy metals, all kinds of things. People who have their wisdom teeth removed, very often we see problems in the gut and the heart. And these are meridians that regulate, that help and are connected to the regulation of these vital organ groups. So it's not that an infection in the tooth directly causes an infection in the breast, although that's possible because there are bacteria in the mouth that have made them their way all the way down to the colon. But what we see is that there's a very important regulatory process. We regulate, and in biologic medicine, which biologic dentistry is a subset of, we regulate on 5 different levels: microbially, biochemically, energetically, that's meridian flow, Psycho-emotionally, you can actually dysregulate your body by just what you think and what you set your intentions on. There's a Dr. Bruce Lipton wrote a book, the Biology of Belief. What you believe can actually alter cell expression, alter cellular expression, alter even alter DNA. Just psycho-emotion. So that's a very important level of regulation. I have many patients who've had Lyme disease that come to me to clean up their mouths so they can start regulating, their body can regulate and really recover from Lyme. And many of them have been sick for a while and they get what I call stinking thinking. They don't think they're going to get better because they've been sick for 3, 4, 5 years. They've gone to 50 doctors. And if you don't think you're going to get better, you're not going to get better. And those are patients that I often hesitate to treat. So I want a patient to come in and say, Doctor, I'm on a path to wellness, and there's been twists and turns, but I believe that I have a divine capacity to self-regulate and heal, and that's what I'm asking for your assistance with. That's a much different statement than, I don't know if I'll ever get better. That's a totally different mindset. So it's really important to understand that your mouth has an important role in regulation on all of those 5 levels. Those 5 levels, again, microbial level, your microbiome. We see biochemical regulation. People with heavy metals often dysregulate their thyroid, which affects hormone expression and things like that. And there's also we talked about meridian flow and psycho-emotional, and then we also talk about being regulated um, in terms of the spirit body. We are mind, body, spirit. That's not just an expression. So regulating on a spiritual level is staying connected. Prayer, meditation, yoga, these are ways that you can stay connected, get out of your mind, and really get to your higher self.